Welcome to Portland Public Schools Parent University. My name is Grace Valenzuela. I am the Communications and Community Partnerships Director for the district. And for those of you joining us for the first time in Parent University is a platform that the district uses to engage and inform parents on issues that are important to the educational success of their children. Tonight's topic is pooled testing, and to kick us off is our superintendent, Javier Botana.
Thank you, Grace, and welcome everyone. Thank you for joining us tonight. I'm Javier Botana, the proud superintendent of the Portland Public Schools, and I'm extremely happy to be able to welcome you to this informative session about our pooled testing program, which we are about to launch. Yesterday was our first day of school, and it was absolutely outstanding to be able to be out and about, visiting our schools and seeing our students enjoying being in person with their teachers, with their friends, in their schools for the first time in really 18 months. So a very, very long time. And we want to be able to keep that experience going. And as a district, we've made a commitment to doing everything that we can to keep our schools open so that our students can continue to have the experience that I observed them having yesterday. And one of the key ways that we do that is by implementing what we call our health and safety protocols. And so those are things such as urging all of our students who are old enough to receive the COVID vaccine to take the vaccine, to urge all of our staff to take the vaccine. It also includes making sure that when we are in school, indoors, everyone wears a mask. It also includes improving our ventilation in our buildings, trying to have our students outdoors as much as possible because we know that that's safer for our students. It also includes keeping our distance as much as possible. And it's not always possible to do everything that we would like in that area, because for us to be able to have all of our students back in school, we can't keep 6 feet distance, but we've committed to 3 feet of distance when students are eating in the cafeteria. And so what we're here to talk about today is our pooled testing effort. This is another measure to help us to mitigate the spread of COVID in our schools. And so we very much hope that many of our families will accept the opportunity to be a part of our pooled testing program. And we have with us today to talk about pooled testing our head nurse, Tina Valiu. Tina has been an amazing resource to the school district for these past 3 school years, actually many more before that, but particularly during these past 3 school years, she's been an incredible partner and knowledgeable supporter of doing all of the right things to keep our students safe and healthy. And so Tina is going to talk a little bit about it and introduce our partners in Concentric to also talk a little bit more about that. So Tina?
Thank you, and thank you for inviting me. I have been working with the nurses for the past several weeks about pooled testing specifically. We have been meeting with Concentric and attending trainings so that we have all the information we need. We have the training we need. We have already received some of the supplies. So this is a big project that we're looking forward to, and we want it to go smoothly. The nurses are very engaged because we know that this will be another important way to keep the school safe and to keep school open. Lots of staff are very interested, and we hope many students will participate also. So with that, I will introduce Benjamin Rome is here, and he is from the company that will be running, that is the lab that will be running the testing. And he's going to give a presentation about what is involved in the pooled testing.
Great.
Thanks.
Thank you, Tina.
And just to interrupt just a second, just a reminder to folks that as you listen to Ben, and if you have questions, the Q&A tab is already open, so you can write your questions there for Ben and Tina or Javier and our Assistant Superintendent, Aaron Townsend. Thank you.
Great. Yeah, so thank you so much for having me tonight. Just in terms of introduction, my name is Ben Rome from Concentric by Ginkgo. I oversee all of our K through 12 COVID testing programs across the Northeastern United States, obviously including the program with the state of Maine. And yeah, as Grace mentioned, I want to give a short presentation that just talks a little bit about what the testing is and what it looks like, and then we can open it up for Q&A. Great. So just a little bit of background on us, Concentric by Ginkgo Bioworks. We are a biotechnology company. We were founded in 2009, and we're based out of Boston, but are operating nationally. And last year, we pivoted a large portion of our platform to COVID testing. And since last fall, have been pretty exclusively focused on the K through 12 space. So thinking about how can we design testing programs that really work for the classroom environment. As with all the nuances of that environment, it's often difficult to just take another testing program, that works at a physician's office or other community setting and plug it into K-12. So our mission with the testing program is really to keep kids in class, right? And to minimize the disruption to in-person learning and do so safely, right? And so that's really, as we go through this, that's really the goal of the testing program. In terms of our experience, so as I mentioned, we began testing in the K-12 space last year. We've tested to date at over 1,000 schools across 25 different states. And what that's allowed is for us to really get a sense of how to create and continuously improve a program to work in all different types of districts, right? So large, small, urban, rural, public schools, private schools, etc. So the thing I want to talk about now is really just why test, right? What are the benefits of testing? As folks from the district mentioned, it's an optional opt-in program. So anyone, for any student under 18, it requires a parent consent to participate. And so really the reason that that we do this testing is really two things. One, to help identify any asymptomatic COVID cases in order to take appropriate action before they spread. But secondly, the asymptomatic testing is a great data generator for the district to understand what level of COVID prevalence is in the community, is in the school community, and thus can take kind of appropriate actions in terms of other mitigation methods in order to keep the school safe. So now I want to talk a little bit about the Maine statewide program and what this will look like for the district. So the foundation of our program, of our testing program, is what's called pooled testing or cohort testing. And what that is when the individuals in a cohort, so that could be a classroom, a sports team, an extracurricular group, have all of their individual samples combined into a single tube. And that tube is then run at the lab and generates a single result for that cohort. The way that actually works is the collection method is a lower nasal swab. So a swab that just goes in the inside of the nostril. It is not the deep nasal nasopharyngeal swab that you may have experienced in testing earlier in the pandemic. Most students we have found are comfortable self-swabbing. So generally what we found is kindergartners and older are comfortable self-swabbing. But for pre-K, special needs individuals, or just individuals that are not comfortable, that's where a nurse would assist in the swab. So the way that it works is each individual swabs their nose. It's 4 circles in each nostril with what basically looks like a Q-tip. That swab goes into the tube at the front of the class or at the sports team. And that goes to our lab to generate a result. One of the other just nice parts about this type of testing to call out is that when the lab receives that tube has a barcode on it, and that barcode is linked to a name for that pool, for that cohort. So it might be, Mrs. Smith's 2nd grade class, or it might be girls soccer team, or maybe just, pool 6. The lab does not know which individuals are actually in that pool. So that's a nice privacy feature of this type of testing that we like. So in terms of why we do this type of pooling, one of the really nice parts I mentioned early on, the goal here is to keep kids in the classroom and minimize any disruption to classroom learning. That process that I outlined, where individuals swab their nose and then put that swab into the tube at the front of the class, generally takes about 10 minutes per classroom. So it's quite a quick and efficient process. As I mentioned as well, we've also found that it's quite easy for even young kids to do. We've actually found in a lot of cases that the younger kids are better at it than some of the older kids because they're listening and paying attention. And a lot of the kids kind of come up with funny phrases like, if you can pick your nose, you can swab your nose, things like that. So as I mentioned, all of the individual samples are combined into a single tube. That tube goes to the lab and generates a single result. So, Mrs. Smith's class gets back the result. and that result is either negative or positive. If it's negative, that means that there's no COVID present in that classroom, and they can go on about their day, about their week. And if it's positive, what we do is then utilize a rapid antigen test, so a 15-minute test, and test each individual in that cohort, in that pool, to allow us to determine which person or persons within that pool are COVID positive, so that they can take the appropriate action with regards to isolation. And just for a point of reference, you can see on the slide here, during last school year across the country, we saw a pool positivity rate of about 1%. So 1% of classrooms or cohorts coming back positive. Now, we don't know exactly what this will look like this fall, given return from summer vacation, summer travel, and the Delta variant. But that's just a point of reference to kind of have in mind. I want to just show a brief video of what this, of some of the testing we did this summer at a district in Maine, just to help bring this process to life a little bit.
The effort to get kids back in the classroom free of COVID-19 is underway even in the summer. The Maine Department of Education will offer pool PCR testing to all of the state's schools this year. Brian Sullivan has more from Settamocha Middle School in Dover-Foxcroft, where the program is already being implemented.
We have 132 schools that are currently enrolled.
Maine Department of Education school nurse consultant Emily Poland says of that group, 11 are already rolling it out. One of them here in Dover-Foxcroft.
Pool testing is a way to COVID test groups of students.
Courtney Arcaro is Settamocha's school nurse.
I have them separated kind of into like a cohort or a group, and all of the students who have parent consent swab their nose, put their swab into the tube, which is not labeled with any student identifiers, and then those tubes get sent off.
It's a highly sensitive test, and that can pick up very low levels of the virus. So we're picking up positive cases up to 48 hours before they would have even been infectious.
Any kid who can pick their nose, which is most, can do the swab, and it's really easy. So I have kindergartners, headed into first grade that you saw earlier doing their own swabs.
Arcaro, who has children that are students at the school, hopes other parents will opt their kids into the testing.
The greater participation that we have, the better the results and the safer we can keep students.
I feel like we're in a better position than we were last fall. We know a lot more about COVID than we did last August. So certainly schools have proven that they can do this.
As the new school year draws closer, it will ultimately come down to local control.
Because we do have some lessons learned. We have these mitigation strategies that we can layer on top of each other, such as the pool testing, the masking, physical distancing, hand washing, making sure kids stay home when they're sick. All of those are tools, and a local district, a local school needs to decide which of these tools are we going to be using and when.
Brian Sullivan, WABI TV5 News, Dover-Foxcroft.
Great. So that's all in terms of the formal presentation, and happy to go into questions.
Okay, first question we have in the Q&A is if we have universal masking requirements, what is the difference if a group, so if the school has a mandatory masking policy and there's an exposure in the classroom, does the student need to quarantine from the class? You can read the question in the, I'm not sure, maybe Tina can read the question and explain it better than I can.
You're talking about the first question about the 3 foot. So that is true that if they're more than 3 feet for the duration of the class and doing universal testing, and there's been no physical contact, then they may not have to quarantine. But in an elementary school, that is probably going to be very difficult to know that throughout the course of a day, students have been more than 3 feet apart and that there hasn't been any physical contact. So I don't know that we'll be able to use that very much in the elementary school.
And one thing I can just add there, one of the nice parts about using the rapid antigen test as a follow-up to the positive pool is that once you get a positive pool, you can then test everyone in that pool right away, and you don't have to wait for a result, so you're not quarantining a large group.
Okay, the second question is, where will the
Before you move on, Maureen, can I just interject something? And I also just, that's a great question, but I also just want to encourage everyone to participate in the pool testing because it helps us to have a handle on whether all of our mitigation strategies are working, and as Ben mentioned, the prevalence of COVID in the school community. So this is not only avoid being quarantined, but also help us, to be able to track and understand what the presence of COVID is within our school community. If we don't have anybody in pools, then we won't know if we actually have COVID until somebody actually is sick. So I think it's also important that, a big part of what we're trying to do today is to encourage our families to participate in the pool testing. So, we want you to understand what it is, but we also want you to join. And so that is a big part of what we're trying to do.
So the second question is, where will the testing take place? Maybe Tina can answer that.
Go for it.
When they do the swabs for the first test day of the pool, that will be in the classroom. If there needs to be a follow-up, if there's a positive pool, we will probably start, if we're at school, we'll do those maybe outside. It will vary from school to school, whether some of that will happen in the nurse's office or if we can do it outside.
Ben, could you clarify what the definition of a pool is?
Yeah, absolutely. So a pool itself it's that tube of individual swabs, and that can be anywhere from 5 to 25 individuals. And so usually a pool or a cohort is made up of a classroom or a sports team or an extracurricular group. But really what a pool means is just the group of individual samples that are combined into one.
How would we know if someone is COVID positive if all the swabs are in one container?
Yeah, great question. So the way that works is the result comes back for the pool, and you don't know at that point which individual or individuals is positive. As soon as you receive the positive result, that's when you then utilize the rapid antigen test, which is a 15-minute test to determine which specific people or person in that pool is positive.
So I think you answered this. How long will the turnaround be for a positive on the second test?
Yep. So in terms of both steps of the process, the pooled test will get picked up via our courier from the school and taken to our lab outside of Boston. So it'll arrive at the lab later that day. And then the results of the pool will be available within 24 hours of receipt at the lab. And then the second piece, which is once you have the positive pool, and you do that second test, that's a 15-minute test.
Okay, so for clarification, if a child does not participate in the pool, will they have to quarantine, even though the DOE says they wouldn't if there's universal masking?
So I think in a middle school where they're going to have seating charts and they're, at their desk for a block, they may not have to quarantine if they are outside of the distance. But in an elementary, it's just thinking about how elementary schools work all day. Kids move around a lot. They're in the same class, for 6.5 hours. It's kind of hard to think that we could really monitor if they'd been within 3 feet of each other throughout the course of a day. That was and we may be looking back 24, 48 hours from when there was a positive. So for that reason, I don't know how useful that is in the elementary level.
And Tina, is it also not true that if the student was within those 3 feet, but they tested negative in the follow-up, they also would not have to quarantine?
Correct. Yep.
And otherwise, they would have to quarantine. So if you were within 3 feet, so you were considered a close contact, if you were not in the pool, you would automatically have to quarantine. If you were in the pool, you would be tested the second time. And if you were negative, you would not have to quarantine.
Yes. So the next question, Benjamin, are the pools getting the PCR or antigen tests?
Yep. So the pool test is a PCR test, so a highly sensitive test.
Okay. So another question about the 3 feet. So in the pictures, they show children within 3 feet of each other without mask. I'm confused as to why it's okay to remove masks for testing, but not okay to go without masks throughout the rest of the day.
Yeah, that's a great question, and was actually my reaction as well when I saw that video. That school, this was a school that was testing over the summer. Their district's protocol, as I understand it, was that they did not have masking. So that was an individual school's decision. Our recommendation when testing is maintain masking, maintain distancing. And when an individual does do the swab, they pull down their mask in the same way they would if they were taking a sip of water to do the swabbing. So great question. And that basically comes down to the individual school's policy.
So how often will each cohort be tested?
Yes, so generally cohorts are tested weekly. Tina, is that the plan for you all?
Yes, that's our plan, once a week. Yes.
What is the percentage of the children in the classroom that needs to participate for pooled testing to work?
Yeah, that's a really great question. So there's no hard number, like true cutoff, as in you need this percentage. I'll say a couple of things. The more that participate, obviously the better. But there also have been studies that have looked at low levels of participation, specifically between 10% and 20% of a population, that have shown that you still do get benefits of reducing the spread of COVID, even at a 10 to 20% of your population.
And in our case, we're planning to move forward with it regardless of how many people sign up. We think that obviously the benefit that Ben described is significant. We also believe that for those who participate, the ability to be able to remain in school if there is a positive case makes it worthwhile doing. And we also have seen, from the experience in other places that the numbers start low and then over time they increase. So we are hoping to also be able to do that people will see the benefit of not having to quarantine and will sign on, even if in the beginning they were hesitant to do that.
So the next question is about parents' access to the test results. How will parents get access to the test results? How long does it take? And the second part, Tina or Grace maybe can answer, where do parents get the consent form for their kids to participate?
Yeah, sure. So on the first part of that question, the results go directly back to the school, and then the school then communicates that out to parents.
So in the case of a positive pool, we would test the students in that pool. We would notify, immediately by telephone the positive person that was found, and then the rest of the class would be notified that there was a positive, and we would continue as we did last year when there were cases. Then once we have a positive, it's just treated as a positive, and we would continue communication as we did last year with notification of the school community that there was a case.
So I want to answer the where the consent forms should be sent. So we have a paper copy of the consent form that was sent in the staff and community newsletter last 2 weeks ago, and then schools also have a copy of that and being sent to families. Then we also created an electronic copy of the in a Google format for the consent form. And so signing that on electronically it means that you signifies consent. And that link is going to be posted on the chat. So for the electronic Google form. And we are also going to put it out on our social media platform. Our website will be on our school spotlight banner, and it will be accessed as well in that platform.
So the next question, Ben or Tina, if a child has already had COVID this summer and will test positive, they're saying for 90 days because they had COVID, what should they do?
Yeah, great question. So our recommendation based on that CDC guidance is that anyone who has tested positive in the last 90 days does not participate in the pool, because as the individual asking the question alluded to, that can generate a positive result, even though that student is not contagious. I don't know, Tina, if there's anything you would add.
No, that's the same. They would.
Would that student need to quarantine if they were a close contact?
No.
Okay. So as I understand it, this question says, anyone not in the pool would automatically have to quarantine if there was a positive in their pool. These students may not submit a negative antigen test to stay in the class. Is that correct?
Yes, that's correct. And the reason is the virus, if is contracted, it could harbor from 2 to 14 days. So a one-time antigen test just gives you, it results is that one point in time. And the reason someone in a pool can continue to come to school is because they are weekly being surveyed with the test. So there's weekly surveillance going on, at 7 days and again at 14 days. And and weekly after that.
Will the parents be informed about how many opt in to the pool testing in their class? And if only a couple people opt in, would that be a useful sample size?
I think you have to have at least 5. Is that right, Ben?
Yeah, so you need at least 5 in the pool. What some schools will do is if there are only 1 or 2 individuals in a class, they might combine 2 classes into a pool, or they may not test that classroom, and that's up to the school.
Will we inform the parents, Tina, if their class is, should they assume that their class is testing, or we would inform them if they weren't for some reason?
Yes, I guess we could.
We would definitely attempt to get more people to sign up. That is our, number one strategy for any of this. I think if you're in the pool, you'll know if that class is testing because your child will tell you that they tested on that particular day. If you're not in the pool, we won't be telling you what the percentage of people is in the pool. We will be encouraging you to join the pool.
And I think I can reiterate this next question. How often are the cohorts tested? And they are tested once a week. If Delta starts to transmit to others 36 hours after a person is infected, but a positive test only shows up 4 days after a person is infected, how will you catch it in time?
Yeah, great question. Sorry, I was just waiting for, I think, the interpreters. Good to go?
No, yeah. Oh, you didn't hear the question? Okay, so the question is basically a timing issue. If it transmits 36 hours after a person is infected, but a positive test only shows up 4 days after a person is infected, how will we catch it in time?
Yeah, so it's a great question. The pooled test, as I mentioned, uses PCR technology for the test, so it is the most sensitive testing type. That doesn't mean, based on the timing, as you pointed out, that doesn't mean that it's going to catch every single infection. But the idea is that by doing this testing on a weekly basis, it's really one mitigation tactic amongst a whole suite of tactics, right? So masking, distancing, hand washing, etc. None of those on their own are meant to be, a silver bullet or a perfect measure. But together, you can minimize your risk. We definitely have seen cases where you are picking up asymptomatic individuals, which is the idea of the test. And while they may have started to spread it, you're limiting the spread by catching it as soon as possible. And I think one thing to think about, right, is in an ideal world or ideal to some, you're testing every day or every hour, there's you have to think about always the trade-off between minimizing the disruption in the classroom, but also providing that data that the tests give you.
So this is a good question, I think, pertinent to our district. If there are students in different grades in different schools in a single family, and one of those children tests positive, do all the children in the family need to quarantine?
They will likely still have to quarantine. I was at a meeting last night when we were talking about this. And so there is this is still being discussed, I think. But because of that, there is ongoing, consistent exposure to the virus by living with someone with a virus, that is extremely high risk to contract it. And in that case, it is likely that the family, we would continue the same rules, which is the family would have to quarantine.
Do you plan on pool testing randomly or because symptoms have shown up?
Great question. So the pooled testing is specifically for those without symptoms, right? And so this is more of a random testing for any asymptomatic cases. Anyone with symptoms obviously should not be coming to school and would not be included in a pool.
If an individual tests positive from the pool test, how long do they need to quarantine? And do the close contacts need to quarantine? Why or why not?
So the question is, if you are the positive person in the pool, you test positive, you would need to isolate, and quarantine. So really be separate from your family as much as is possible for children for 10 days, either from the test day if they don't have symptoms, or 10 days from the onset of symptoms, and symptoms have improved, and they have been without a fever for at least 24 hours without medication.
And do the close contacts need to quarantine? Why or why not?
So the close contacts, so once we have the positive pool, we would identify close contacts, and close contacts do need to quarantine, with the exception of close contacts that are participating in pool testing because they are having weekly ongoing surveillance, as long as they don't have symptoms. With older kids, it may be possible if there's universal masking and we can clearly identify they have been outside of 3 feet of the positive person. That would be a case-by-case basis. They may be able to continue to attend school.
So a question about, given the low sensitivity for asymptomatic people of the Binax test, why isn't a PCR used as the follow-up?
Yeah.
Great. So I'm happy to take it.
Go ahead. Yeah.
I was just waiting for the interpreters. I can take it and then feel free to chime in. So great question. I guess a couple answers. So first, this was a programmatic decision made by the State Department of Health. But in terms of kind of the thinking behind that, I can just share a few points. This program, the pooled PCR followed by an individual antigen test, is a program designed that Massachusetts ran starting in January of last year through the school year, through the summer. They were actually able to collect a lot of data on the technique and put out a study which basically showed that at high levels of infectiousness, so that was determined as a CT value, which is a measure of infectiousness lower than 30, that in over 92% of pools, the rapid antigen test was able to determine a positive individual in the pool. The one other point I'll add, kind of going back to my last point about none of these measures are perfect. When you when you do the PCR follow-up test, the trade-off there is a longer turnaround time, right? So you are trading off some sensitivity or accuracy with time to get your results back.
Thank you. Just remind people who have their hands up, if you could please type your question in the Q&A. I already have many to go through here, so we're going to try to answer those as quick as we can. Did the TV clip say that the test can detect infection up to 2 days prior to infectious period? If that's correct, can you say when the pooled test can become positive during an individual's infection?
I think we need to repeat the question.
Okay. Hopefully I'm saying it correctly. The TV clip said that the test can detect infection up to 2 days prior to the infectious period. If that's correct, can you say when the pooled test can become positive during an individual's infection?
Yeah. So that was what the nurse mentioned in the video. I've seen a lot of different studies about infectivity periods and when tests pick those up. So there's a lot of different data points out there. So it's probably not for me to weigh in. I think there's a lot of differing thoughts there. What I will say is that the pooled test, which is a PCR test, is the most sensitive type of test. And I don't know if Tina, you would add anything to that.
And I guess I would just add what I've heard is one reason why the district is doing the pooled testing once a week is to stay on top of that issue. So again, kids are tested once a week. This is a great question. What if a child is absent on the pooled testing day?
I think we will be only running this 1 day a week. It has to go in the tube with the other participants. It gets sent to Massachusetts, to the lab in Massachusetts. So if they miss it, they will just, continue to participate the next week they are there.
I think the question would be, Tina, if I'm part of the pooled testing, but I missed that day because I was sick or I was out, and there happened to be a positive that day in my class, am I going to have to quarantine because I wasn't there and part of the pooled testing?
Well, I think if you've been enrolled and you are back, you could still have the rapid test, and then you would be tested again the following Monday or whatever day we do it. So,
great. So if there was a positive, right, you're still not out sick, and there was a positive, you go through the rapid testing because you're part of the pool. Okay. What cycle thresholds are the PCR tests for the pooled tests? I'm not sure I understand. Maybe you do, Ben.
Yeah. So the cycle threshold is it's basically at the lab how it determines how sensitive the test is. So what level of virus is picked up in the pool. I don't know exactly what cycle threshold they use. What I can share is that the highest CT value at which the software detects COVID is 37.
Okay. If you're not in the pool and there's a positive and you're a close contact, can you get a test outside of school so you don't have to quarantine?
You should get a test outside of school if you're a close contact, but you cannot get out of quarantining.
So we answered the one about tests. If only 1% of tests are positive. Oh, sorry, Juliana. I'm forgetting to let the interpreters answer the questions. If only 1% of tests are positive, why are kids tested every week? If tests are consistently negative, will all schools still have to test every week, or will testing subside over time?
Yeah, so that's a great question. What I'll say is that 1% figure was what we observed last year, and was a data point that allowed schools to then make decisions about how to use or not use additional mitigation measures. We don't know what that number looks like going forward, and so the idea is that you have that piece of information in order to make decisions. And then I think the second part of the question I would defer to the district on.
You know, obviously, we're not going to continue to test if it's no longer necessary, but, you know, that will be the decision point for us. If we're seeing that, you know, there are no longer cases of COVID, or if we find that the program isn't helping us in any way, then we will obviously discontinue it. But, you know, there's lots of what ifs in there. And so we'll have to cross that bridge when we get there.
So the other question is, why are we doing K to 6 and not K to 12, grades K to 12?
Let me take a stab at it just from a policy perspective. We've decided to do that because there's a significant amount of work that goes into being able to get this program off the ground. So we're focusing right now on getting it off the ground with the students that we know cannot be vaccinated. So that's our lower grades. And so that's where we're starting. We're not ruling out the possibility of doing it with other grades and time. You know, we've talked about next step would be to do it at all of the middle schools instead of just at the 6th grade in the middle school, doing things with our students who are in on sports teams and things along those lines. But, you know, we have limited capacity. We've not done this before. We're trying to take off reasonable bite-size efforts and go from there. Again, as you've heard throughout, this is not a panacea. It is not going to stop COVID. It is one of the mitigation steps that we are putting in place. And so we have all of those other mitigation steps. This one we believe helps, and it makes the most sense for us to start it with the students that we know cannot be vaccinated. We're going to do everything that we can to get as many of our students vaccinated as possible, because we believe that even though that, as you point out, is not a silver bullet either, it is the strongest deterrent that we have for COVID. And so we're going to put all of our energy in the upper grades and getting, you know, all of our students, or as close to all of our students as possible, vaccinated. But we're not ruling out using pooled testing with other groups as well.
Are parents told of only positive results or negative results as well?
I think we would only be notifying about positive pools and positive cases.
So no news is good news.
Right.
All right. The turnaround on the PCR test is 24 hours, correct, Benjamin?
Yeah, it's a maximum of 24 hours from when the lab receives it. The lab receives it the same day of the test, so a maximum of just over 24 hours.
So with all the findings from the pooled testing, let's say there are no cases in the first month, at what point will masks no longer be required to wear at school?
So let me just answer that again, you know, and I know I'm sounding like a broken record. We're looking at all of these B, cumulative supports to reducing the spread of the virus. At this point, we have no plans to discontinue the use of masks anytime in the near future. So we're not connecting the low prevalence of positive results in the pool testing to the decision to get rid of masks. In fact, we would be thinking that masks are helping us to keep that rate low. And so it's working, and we will continue it until there is no longer a need to be worried about COVID.
Are teachers participating in the pool testing?
Yes, they can. It's voluntary, but many have already expressed interest in participating.
And we're encouraging it also as a way of modeling for their students.
Will remote learning be provided to students who need to quarantine?
We will not. We've said that if we reached a point where we had 50% or more of the students in a class who had to be out for quarantine, that at that point we would likely move that class into remote instruction. And so at that point, everybody would have remote instruction. The students who were, positive, the students who were in a quarantine situation, and the students who were in the pool test and, were negative. But because there's just too many students who are out, we would switch the class to remote. And this is the way we're thinking about it at this point, 50%, just as a threshold, but we will adjust that as time goes by as well.
What will we be doing for students' mental health with the constant medical testing and messaging that goes along with it?
Well, one thing I would say is the messaging doesn't have to be, totally negative. Obviously this is serious what we're doing, but this is an active thing that kids can participate to help with their own safety and with the safety of the people around them. And I have seen kids that respond very positively to that. But I do know everything we're going through has been difficult for children, and schools are being supportive as possible. We've put in, new supports in a lot of the schools with additional social workers and emotional help for children. But I think this, the messaging doesn't have to be completely negative.
Of course, I agree with Tina, and then to that point, we've prioritized throughout the pandemic, making sure that we're attending to students' individual mental health needs. So in addition to sort of universal measures, when we know that a student is struggling with, with mental health issues, we want to work closely with the families to ensure that we're providing the supports that are necessary for that particular student's well-being. So, there isn't something universally negative about taking care of each other. We think that is actually a very positive message, but, different students receive that in different ways. And so if you have a child who's experiencing stress, anxiety, or something along those lines as a result of the testing, it would definitely be warrant a conversation with your school nurse, with your school social worker, with your school principal to determine what makes the most sense in that individual case.
Okay, well, we're over our time. Do we want to answer the following questions offline, or Grace, would you like to continue?
I think we have to choose which ones in these questions, Maureen, are really relevant and important to respond to at this time. So there's a lot more questions that we can that we can pull. So is there anything here that Tina and Ben, that will be important to us at the answer at this time?
I think there's a question about if the child has to quarantine multiple times during a school year, could this result in the student not being able to move forward to the next grade level? Do they count the quarantine days as absences?
The quarantine days are considered excused absences. They're medically necessary. So students will have the opportunity to make up work that they may have missed as a result of being out on quarantine. They will also have the opportunity to get support from their teachers and assistants to catch up on what they may have missed. They will not have simultaneous remote instruction, but we will support them in the same way that we support any student who's out for any reason, whether it's quarantines or something else. And again, part of the purpose of the pool testing is to prevent students from being out on quarantine. So if you're concerned about many absences as a result of quarantine, participating in the pool testing is the most helpful thing you can do, because if you are participating in the pool testing, if there is a positive in the pool and we test you with the rapid test, when we find out that somebody in the pool was positive, you will not have to quarantine if your test comes back negative. So again, the single most valuable thing you can do to not miss days for quarantine is to participate in the pool testing.
And there's a question about if a child is not in the pool testing and there was a positive, would the family be notified? And yes, of course, those families would be notified. All families in the classroom will be notified of any positive tests in that classroom and told what should be done from there. Are there any requirements for teachers who are not vaccinated to be in the pool testing?
Not at this time, but the board is looking at our vaccination rates among teachers and other staff at Tuesday's board meeting. And one of the possibilities from that would be a vaccine requirement for staff.
We can make the recording available on our website after this meeting. I also see there's quite a few questions about the Google form, so we will work and fix those problems and make sure that is posted correctly. Why are Portland Public Schools staff and teachers not required to be vaccinated?
I've answered that.
Okay. All right. I think we've answered all the questions related to pool testing.
There's a question that's come up several times about the program funding. I don't know what that is, but I just want everyone in Portland to know that Portland Public Schools is not spending any money on this pool testing, but this pool testing is being subsidized by the state, and that they have a contract directly with Concentra.
Anything else you want to add, Tina or Benjamin?
Nothing from my end.
Any other relevant questions you see there, Grace, that we need to address?
I think that we're good to go. We are 15 minutes over time, and So we will fix the Google form. It just seems like there's a setting that we need to fix, and we will send that in the upcoming staff and community newsletter that we're sending the end of this week. And any other last message, Javier?
I just want to thank everyone for being here. I do hope that this has answered most of your questions. We will obviously look through the serious questions that you've asked and attempt to answer those, put them in additional FAQs. We have FAQs already online about this that are very thorough, and I really do urge you, if you have questions, to look at those. We will, as Grace said, continue to send information out so that you have all of the information that you need. But I really do hope that people will take advantage of this. This is, again, intended to be one more way for us to be able to limit the spread of the disease. We wouldn't be doing this if we didn't think that it helped, if there wasn't evidence that it helps. Again, not evidence that it is perfect, not evidence that it is going to make COVID go away. It's just going to help us to limit the spread of the virus, which is really what we want to do. What we care about is keeping our kids in school every day for the entire year. And the more we can limit the spread of COVID, the more likely it is that we will be able to do that. Again, to people who are concerned about quarantine, the best way to avoid quarantine is to participate in the program. So I hope this has helped to inform that for you. And, we look forward to many of our students being allowed to sign on, and hopefully us being able to limit the spread of COVID and keep our schools open all year.
There is also
Thank you.
there is also an evaluation form that has been posted there for this event, and the FAQs on our PPS website has been linked in that chat. So thank you very much for your time, and we look forward to seeing you again in another Parent U event.